Hello, everyone, and thank you, Dr. Lewin, for asking me to present today. I'm really excited to be here with you guys. So, like Dr. Lewin said, my name is Ryan Lucash, and I'm a pediatric psychologist at Children's Hospital of Los Angeles. And essentially what a pediatric psychologist is a psychologist who's specifically trained in working with children with chronic and acute medical illnesses. So one of the privileges that I have at Children's Hospital Los Angeles is working with craniofacial populations, and specifically with children diagnosed with microtia, in both a research setting and then also in a clinical setting as well. So while we have a large research study going on at Children's Hospital of Los Angeles looking at psychological functioning of children with microtia, I'm really more going to focus today on my clinical work and talk a little bit about what you guys can do as parents to help boost the psychological functioning of your children and help build them up for success. So I'll start off a little bit by talking about what we know about children with diagnosed with microtia. So if you look at the literature that's out there now, it can actually be a little bit scary. Some of the literature would suggest, is that better? Okay. So if you look at some of the scientific literature that's out there now, some of it can be a little bit scary. Some of it can say that children diagnosed with microtia have certain levels of depression, anxiety, social difficulties, a lot of interpersonal sensitivity issues, as well as hostility, aggression, and that these children really can experience a lot of teasing, mocking, and even bullying can be a really common experience with these children, as well as social isolation, so not having as many friends, maybe being more isolated from their peers. And what we also know is that children notice that there's a big difference in their ears from a very young age. So there's research to suggest that children can understand and notice that their ears are different from the age as young as 2. Okay, so now that I'm the Debbie Downer of the conference, let's talk about, there's good news too. Okay, so the good news is actually that the majority of children actually don't have clinical levels of depression or anxiety or social difficulties. So if we look at the large majority of children, they don't have these difficulties. And the even better news is that you as parents can be the best advocate for your child in that you can model really appropriate coping and communication skills that will really help buffer against these social stressors that they could experience in school. And additionally, I know a lot of you guys today are trying to decide whether or not surgery is the best option for your family. And what we know is that the majority of children who undergo the surgical reconstruction have further reductions in their negative outcomes, so reduced levels of depression, anxiety, and social difficulties, and actually can help boost self-esteem. Okay? So the next thing I'm going to talk a little bit about is, but what can you do specifically with your child at home to help with their communication and coping skills? So the first and foremost thing that I'll suggest to you is just being open and honest in your communication with your child all the way from birth, so that they grow up really with this sense of, you know, I have microtia, but it's something that's just part of me. It's something that we openly talk about. It's not something that my family's trying to hide from other people. And it's really important to just do this naturally from birth. So it's just something that you guys are comfortable talking about. So it's not something you feel like you have to wait till a certain age to talk about. And of course, that's going to change depending on the age of the child and their developmental language abilities. But you really want to be open right from the beginning. And when you're doing that, you want to make sure you're using really neutral, descriptive language. So for example, instead of saying a deformity or defect, using language like a small ear or a little ear, in that you're not going to have surgery to fix it, but you're going to have surgery to make it bigger, or instead trying to avoid things like making it better or look nicer. Okay? The next thing that you can do is be consistent. So that's the second thing that I tell parents that's really important. So if you would sometimes wear your hair up and down, you want to make sure you do that for your child as well. So you want your child to see that you're not treating them any differently than you would any other children in your household or you yourself. So you really want to create this sense that it's something that is openly discussed and that it's not a secret and not something that needs to be hidden from other people. And then as well, you can also normalize that we're all born with differences. And I would venture to say that probably all of us in this room have something that we might want to change about ourselves, right? So we all can say that, you know, Aunt Sally's got those big old childbearing hips, or Uncle Tommy's got that curly, crazy hair. You know, we all have something that might be a little bit different from others, and that's what makes us all unique. Okay? But unfortunately, children and adults, unfortunately, are going to sometimes say things that they shouldn't say. So what I do want you to know is that teasing is a part of normal development. So for all children with microtia or not, they're going to experience teasing in school, and that's actually a pretty normal and common experience. But what you can do as parents is help give your children these coping skills to help buffer against the effects of that teasing. So, and when I'm talking about teasing, I don't just mean verbal teasing, but things like staring, asking questions, making rude comments, or name calling. And one of the biggest results that we found from our study at Children's Hospital is that children can experience teasing as young as 2.5 years old. So that's why it's really important to have that open communication with them from birth, because they can start to experience that teasing at a very, very early age. Okay, so what can you do as parents to help them cope with these teasing comments? So one of the biggest things to know as a parent is that overprotection can actually make it harder for children to form the coping skills and confidence. So if mom and dad come in to save the day every day and solve all the problems themselves, the children really aren't going to learn how to cope with that themselves. So the best thing that you can do is actually teach your child how to cope with it themselves. Okay? And one of the most important things is that you're actually practicing it with them. So not just telling them what to do, but actually practice this at home before they actually go out into a social environment and have to use it. And finally, the last thing that I'll suggest is active ignoring. So, you know, when I'm talking to parents about tantruming, for example, if you give a lot of attention to the tantruming child, what are they going to do? They're going to tantrum more, right? It's kind of the same thing with these negative teasing comments. If you give it a lot of attention, the bullies or teasers are going to realize, hey, I got a lot of attention for this. I should probably do this some more, right? If we don't give it a lot of attention, they're going to be less likely to do it. Okay? So one of the privileges that I have at Children's Hospital is to co-lead a couple of the groups that we have. So we have a group called Girl Talk and a group called for young ladies, and a group called YOLO Tango for the young gentlemen. And it really focuses on building up social skills to improve self-confidence and self-esteem. And so I thought I'd share some of the skills that we teach the children in this group so that you can go home and utilize these skills with your children. So you'll see up at the top that I call them steps to success. So in each one of the letters in the acronym STEPS stands for a different skill that you can use with your children. So the first would be self-talk. So self-talk is really saying positive comments about yourself. So I like myself, I think I'm beautiful, I like the way that I look. So things that they really feel about themselves, so that they can, if they're feeling that about themselves, they're going to be able to express that to other people. Okay, and the next three kind of go hand in hand with each other. So you want to have a positive tone of voice. You want to make eye contact so you can show that other person that you're confident and you believe in yourself and you have a lot of self-esteem. And then also the tone of voice. So if you're over here talking like this, that person's probably not going to want to talk to you very much, right? But if you're open, eye contact, good posture, that person's going to be more likely to think, hey, this is a person who feels pretty good about themselves, pretty confident. I better not mess with them, right? And then the last thing is to really smile, okay? So that's the biggest thing. So you want your child to feel good about themselves and portray that to the people that they're interacting with them, okay? And then as well, you also want to have a prepared response for difficult questions that children might be asked. So having a prepared response will really help children know what to say in the moment so they don't have to think of something on the spot. So for example, you might have your child say something like, I was born with a small ear, my doctor is going to make it bigger, or I go to see my doctor for it, and I can hear you fine. Let's go play. So it's really a statement that shows that the child was born with microtia. some sort of statement of reassurance, because other children might think that maybe they might be in pain, that they can't hear you as well, which may be true, may not be true. So you really want some sort of assurance for the other child so it eases some of their anxiety, and then change the subject so that they can get on to something else. What we have found in the groups in working with the kids is that it's really important to practice this, though, because a lot of times the kids will not have any idea what to say on their own. So if you guys can practice it at home, it's going to be a lot easier for them to be able to do it when they go out into the community. Okay. And then as well, not only are the children going to receive difficult questions, but I'm sure as parents, you guys have also heard a lot of difficult questions from them as well. So one of the questions that parents ask me about the most is, why was I born this way? Or why do I have microtia and my other siblings don't? And my suggestion for that is really just being open and honest and at the developmentally appropriate level for your child. Of, some kids are born with microtia and we don't know why yet. And doctors are trying to figure out why it is, okay? And then the other big question that families ask me is, well, what if my child comes to me and says that they don't want surgery when I want them to have surgery, okay? And that's a big individual decision for every family. And then, so that would be my response to you. So psychologists have a joke of saying that we answer every question with, it depends, okay? And I'm unfortunately going to give you that same answer for this one of it depends. That every family is different, and you have to think about your individual factors when making that decision of whether or not surgery is a good option for your family. And I think one of the most important things when working with children is actually making sure what their understanding of the surgery is as well, because they might have some misconception of what the surgery will be like, what's going to happen before, what's going to happen after. I'll give you a personal example of one time I had a child diagnosed with microtia who told me, well, if I have surgery, it means they're going to cut an ear off a dead guy and sew it onto me. So if you think about that, that would be really scary for a child, right? And if you didn't ask him that question, you wouldn't know that he was having those concerns, right? So you might just think he's trying to be defiant or disagree with mom and dad, right? Whereas if you really ask him those questions, you can be able to provide the right information to him or her, okay? Okay, so I want to end with some more positive, uplifting news too, is that really, I want you guys to go home realizing that you can really build up a lot of strength and resiliency in your children, and that you can make all the difference in how your child feels about themselves, okay? And what we've actually seen is that there are a ton of children who are extremely self-confident and self-assured individuals and have really successful social development. So another personal example, so one of the co-investigators on our study, Daniel, he is actually a microtia patient himself, and now he is the chief resident at Cedars-Sinai. So what that goes to show is that children, if brought up in a warm, caring environment that have parents as good models for social development, can really have good social outcomes, okay? But we also know it can be really difficult as well. So as Dr. Sanchez was saying, we really yet don't really know what causes all cases of microtia. So remembering that there's nothing that you could have done to prevent or nothing that you did to cause your child to be born with microtia, and that if you are feeling overwhelmed or struggling with that decision of whether or not to have surgery or how can I best help my child, really make sure to draw on the support of your family and your friends, and also knowing that your medical team providers are here for you as well. So in fact, a lot of craniofacial teams across the country have a psychologist like myself that's devoted to working with their teams, and if they don't, they can give you referrals to somebody in your area that would be able to help support you and your child. So really make sure to draw on that support if you guys need it. So I will be here for the lunch, so if any of you guys have any specific questions about your individual family or child, I'd be happy to talk with you guys, and my email is up here as well if you have any questions. Thank you.